Welcome back, everyone, to Einstein's Eyes. I'm your co-host, Carl Rosen, oculoplastics and neuro-ophthalmology in Anchorage, Alaska. Been here for 30 years. I'm with my friend and co-host, John Didkoff.
Hi, all. This is John. I am an ophthalmologist in northern New Jersey. I met Carl about 30 something years ago. And while we were doing our residency at Albert Einstein, hence Einstein's Eyes. And very excited about the topic today. Carl, take it away.
So we are going to do a follow-up on the recent June 2025 Neuralink meeting with Elon Musk as the presenter and CEO and leader of one of the greatest engineers in probably the last 500 years. Today, we are going to unpack the brand new 2025 Neuralink update, and especially focus on the BlindSight program that aims to restore vision even without an eye, without a retina, without an optic nerve. So far, we have 7 implanted participants with a brain-computer chip interface, a robot that can place an electrode every 1.5 seconds, which is a big upgrade. It used to be 17 seconds it would take for the robot to implant an electrode.
The robot expect a raise for this?
Right. And this touches ophthalmology in a big way. So buckle up, folks. For folks new to Einstein's Eyes and who haven't seen our first video on Neuralink and Elon Musk's brain-computer interface startup, let's recap. They have a flagship implant about the size of a large coin that drops flexible threads with thousands of electrodes into the brain tissue, into the cortex, so the brain can talk directly to a computer through Bluetooth interface. Now, historically, BCIs, or brain-computer interfaces, have been single-digit channels at 1 bit per second. Neuralink's first-gen device already records 1,000 channels, and the goal by 2028, maybe to 2030, is 25,000 plus channels and multi-gigabit bandwidth. They're hoping, and I hope, that this will be accomplished by 2028. So let's start with their first product, telepathy. Now, 7 people, 4 with cervical spine cord injuries, and 3 with ALS, amyotrophic lateral sclerosis, a degenerative disease with no cure, now use the implant at home, and it's changed their lives. And many of these people use the telepathy functionality 50 hours a day, even peaking to 100 hours. It's essentially all waking hours. Now, one participant, Nolan, the first implant patient, set a world record cursor control score on day 1, and he plays Mario Kart and Call of Duty and Sid Meier's Civilization games on his computer, hands-free, just by
To explain that, I mean, at least my understanding of what you're saying is that despite a person being a quadriplegic, they can't move their arms, they can't really move any parts of their body, they were able to telepathically, I mean, through their mind, control something in their environment so that they can enjoy their life much more like a normal person, correct?
It's exactly right.
Yeah.
I mean, it borders on magic.
Yeah.
But through Bluetooth technology, the same technology you have in your iPhone, you do CarPlay in your car, is.
But yes, I mean, they don't even have to, do they say it and it does it, or do they think it?
No, John, they think it. That's the really interesting part. They think it and it happens.
Amazing.
And this has real big implications down the road. And we'll get to that in a minute. So the surgical innovation, surgery still scares clinicians, but the current R1 robot needed 17 seconds per thread. The new robot, the new rig, drops that to 1.5 seconds, an 11-fold speed up, reducing anesthesia time and infection risk, which as surgeons, we know it's always better to operate and to manipulate tissue less. There's less problems, there's less chance for complications, adverse events. Again, less chance for infection and manipulation of tissue, bleeding, tissue degradation, etc. Plus, it holds the implant right on the robot's head. No hands off, so depth and angle are sub-millimeter precise. Imagine that level of finesse when we eventually target the lateral geniculate nucleus or the visual cortex for visual restoration. Now remember, there's algorithms that precisely implant these electrodes in the cortical tissue, in the brain tissue, around blood vessels so you don't get a hemorrhage. Because a hemorrhage can be devastating. You get a subdural or epidural hemorrhage that can put pressure on the brain. So the algorithm allows to identify tissue that is blood vessel free, in between the blood vessels. Put the implant, as we mentioned, the size of a large coin, somewhere between $0.50 and $0.25, just beneath the surface of the skull. Now on to blind sight. The plan.
I want to clarify something, maybe for the audience and for myself. So that piece, whatever you want to call it, that object, it's being implanted in the brain, and it almost like is like something on a phone that receives a message from the brain, but it also can emit a message to somewhere else, correct?
So it can be an input and an output.
Right.
Right.
Does it need a battery?
It does.
So, I mean, how do you recharge it? Do you know?
There's two approaches. One is to change a battery like you would in a remote control, or two is to charge externally like you charge your iPhone now. Those things are being worked out onto blind sight. The plan is a camera-equipped smart eyeglass with a camera in it that streams video to electrodes in your primary visual cortex. This image shows the primary visual cortex in the back of your head. This is called the occipital pole. The vision is interpreted as something called the calcarine fissure, which is deeper inside the brain. This is where blind sight wants to implant the electrodes.
Bypassing the visual center, the eyeball, the nerve, all the things that get to that part. You don't need it.
Bypassing your eye. You just are
You don't need the eyeball,
employing,
you need the
you're
brain.
just employing your visual system, the visual integration center, the occipital pole, the calcarine fissure, where vision is interpreted. And you're using the glasses as your eyeball and as your optic nerve. It streams video to electrodes in your primary visual cortex, creating phosphenes, little points of light that assemble into images. Here you get an idea of what the phosphenes can look like as they are interpreted from the original vision. If you look here as a man standing, you see phosphenes. The interface would combine it with various algorithms and techniques to give you a navigable vision or an understandable vision. Again, not precise, not normal vision, but much better than being blind. This is obviously low resolution. Think of an 8x8 or a 16x16 pixel block. Neuralink and Elon Musk and Blindsight are targeting is a 1600 channel S2 stim chip out of the gate. I'll get to the stim chip and what that does in a minute. That already beats legacy retinal prostheses like the Argus 2 that's been out and being used and implanted on the retina, on the surface of the retina. Timeline, as we see it, is in Q3 of 2025. As far as implants go, there's going to be a speech decoding implant. 2026, the first human blind sight participant is on the launching pad. 2027, a 10,000 channel multi-implant system. 2028, a 25,000 channel whole brain interface and AI integration. Now imagine ChatGPT being input through this brain chip. So like Neo, I think I know Kung Fu. There are ethics and regulations, and Elon emphasized that it'll be a slow, exhaustive regulatory oversight issue. The FDA IDE approval came in 2023, and expansion to Canada, UK, and the UAE just cleared. The company is spreading out. Still, we need long-term data on biocompatibility, thread breakage, because remember, the brain pulsates. And from Nolan, we learned that the implants can pull out as the brain pulsates over time. It can change the position. And that's why the depth has been increased to avoid that. There's always infection, there's signal drift, and there's the privacy elephant. Direct brain data in the cloud. What does that mean? There are parallels in ophthalmology. I mean, we already have the implant, the iStent implant, the express shunts, retinal chips. You know, this is another step, but the risk-benefit calculus must remain patient-centric. Tread lightly here, but I think we are going to move forward for everyone's benefit. The competitive landscape is one that highlights Neuralink isn't alone. There's BlackRock Neurotech that has a 68-channel motor BCI. Paradromics claims a 6,000 channel in preclinical primates. Precision Neuroscience is a company that came from Neuralink, and it's going surface level with 1024 contacts. So a different approach, surface versus implantable. But none have public plans for a camera to cortex vision pipeline at this scale yet, like Neuralink does. Why does the brain chip interface and blind sight matter to ophthalmologists? Imagine pairing blind sight with retinal gene therapy and CRISPR in a trial. Cortical feedback could serve as an objective functional endpoint, or you could have a hybrid device, a prosthetic vision via cortex, while optic nerve regeneration therapy continues to evolve and improve. And that is happening currently. The government is funding that. I saw a great meeting at the Hawaiian Eye meeting last year where they talked about that. Various neurodegenerative mediators, electrical stimuli, things like that we talked about on our NYU eye transplant. Remember that, John?
Yes.
What's next and what's the call to action? So Neuralink is actively recruiting engineers, neurosurgeons, and ophthalmologists for blind sight trials. But I think if you're in an academic medical center, you should start thinking about IRB collaboration now. I should fill in some more information just for the audience. Participant number 7 was the first non-West Coast surgical patient, a 31-year-old US veteran. His initials are RJ. He received his link at the Miami Project to Cure Paralysis on June 27, 2025, so just a few days ago, making the University of Miami the second US implant site and confirming the study's multi-center rollout. So Neuralink, as I mentioned, now lists Canada, UK, and UAE as approved trial geographies on its website. New animal data shows that blind sight is functionally on track. The Neural Interfaces Conference in June 2025, engineers reported the macaque monkey saw artificial flashes delivered straight to its visual cortex without the eye, without the use of an eye or an optic nerve. Straight implanted signals to the visual cortex caused 66% of the time artificial flashes were delivered. And this is the first public evidence that the S-series stim chip, and this is what I mentioned before, can generate usable phosphenes. And the phosphenes are what we would manipulate to create navigable vision. To discuss and explain the hardware refinement, the S2 stim chip, the S2 silicon is now packs 1,600 stimulation channels, plus high dynamic range recording on the same chip, on the same die, built specifically for blind sight. And as I mentioned before, the next gen robot cuts insertion time from 17 seconds to 1.5 seconds, shrinking OR time for the 1,000-lead array 11-fold. John and I know shorter anesthesia time, lower surgical risk, and you get higher visual resolution. Just to highlight the regulatory and financial tailwinds again. So after the 2024 breakthrough, the speech restoration implant received its own FDA breakthrough designation on May 1st, 2025, a sign the agency, the FDA, is comfortable with the platform. Neuralink just closed a $650 million Series D funding round on June 2nd, 2025, pushing its valuation to $9 billion and earmarking funds for high volume manufacturing of the link. With so much money, they have a nice runway, and they really have an advantage over other competing startups. Blindsight is an extraordinary technology that ophthalmologists and really everyone else who's interested in restoring sight is excited for.
Amazing stuff. One question I have is, do you think it's going to be individualized? It sounds like it doesn't need to be. Like, in other words, this sensor that goes in your brain, it's one sensor for everybody, right? I mean, other than maybe the size, it seems like if they get this thing to work and then they can improve on it, it's just a matter of implanting it in the brain. A hearing aid, like a hearing aid, I don't think is really individualized per se. I mean, obviously there are some, but what do you think?
Well, as the technology improves and expands, I mean, think about it, John. You could have sight in different wavelengths, infrared, ultraviolet.
Yeah.
And that AI interface really intrigues me. Really intrigues me. I think that that is extraordinary. And we don't really know what the limits are. Very exciting, John.
And
Really,
the thing is, we have to forget what vision is. Like vision that we grew up with and that we look at as vision. Sure, but there could be another type of vision. A vision that enables someone to be independent. That's really all that matters.
right.
Whether they see in colors or objects, or if they can walk around a room and they can function independently, that would be amazing.
Great stuff. So we'll keep
Yeah,
our
thanks.
audience informed. Thanks for
Okay.
being here, everyone. Please subscribe and like the video if you got value out of this, and we're going to continue to discuss this topic as it moves forward.
If you have any questions, not that we can answer them, but you can try us.
We'll do our best.
We'll do
Thanks
our
again,
best.
guys. John, great
Yeah.
seeing you.
All right, great seeing you.
All right.